Give you a One Health perspective on antimicrobial resistance. I'm sure you're all aware of what the One Health concept is, that human, animal, and environmental health are linked. And because they are linked, complex subjects like antimicrobial resistance that you've been talking about here must be analyzed using an interdisciplinary way. Just want to give a shout out to the website that my colleagues and I run since 2008. It's been serving as a repository for all news and information pertaining to One Health, so please visit it. In my research over the past 5 years, I did an analysis using One Health as a framework to investigate all of these issues that you see on the slide, comparing these different countries, and then on their antibiotic use, resistance, the history of the ban of low-dose growth-promoting antibiotics, livestock production, and on and on. For the sake of time, I'm only going to be able to talk about what's highlighted in red. And a quick disclaimer, I do not represent any countries whose data I am showing you, so any analyses and conclusions that I make are mine alone. And here's the quick disclaimer that the ECDC requires that I show you. So very quickly, over the course of the 20th century, there was an evolution of both modern medicine and agriculture, and there were some very interesting parallels between them. Both became increasingly specialized, technologically driven. Both are dependent on antibiotics. The price of medical care, at least in this country, has skyrocketed, and the price of food in this country has decreased. So on the one hand, antibiotics are the foundation of modern medicine. Many of the treatments that we take for granted, like elective surgeries, cancer chemotherapies, and immunosuppressive therapies, simply cannot be done because the risk for bacterial infection is too high. On the other hand, the agriculture is the foundation of civilization itself, and unfortunately, most people take the availability of food for granted. But with the planet heating up, and I'm going to be talking a bit about that in the next several slides, this is not something that we can take for granted either. So we have a real conundrum here, and we really, if we want to have a modern society, we absolutely must preserve both. We've been very fortunate in this country. This is USDA data. This is the US here. We spend less on food than any other country on the planet. In comparison to, say, Nigeria, where they're spending almost 60% of their income on food. And if you're spending all your salary on food, then you're not going to have money left over for all the gizmos and gadgets and iPods and iPads that people want you to buy. So our entire consumer economy is dependent upon relatively inexpensive food, and you all are at the vanguard for that. We take that for granted. So why is food security so important? As I briefly mentioned about the global climate change, it is the foundation of civilization. And with it in threat, if this becomes threatened, then the foundation starts to crumble, and we absolutely cannot let that happen. It's inextricably linked with global health, global sustainability, and international security. Again, most people in the international global health community don't really think about or talk about. So there is no global health without global food security. And at the same time, many of the diseases that are emerging into human populations, like Ebola, Zika, Chikungunya, SARS, and Nipah, are all emerging and spreading, either indirectly or directly linked to food security. And then climate change affects security. This is a timeline of the temperature of planet Earth since the beginning of complex life on the planet. And what I'd like to highlight here for you, this is the Ice Age here. We did not have agriculture during that period simply because the planet was too cold. It wouldn't have supported agriculture. Agriculture did not develop until the planet started to warm up around here about 10,000 years ago. And what's so striking about this period, the Holocene that we live in now, is that for this entire duration here, the planet has been fairly remarkably stable on this baseline. So in other words, we have agriculture, we have civilization because the climate has allowed it. Now, if you have a little bit of cooling, like the little ice age here, let me just go to this. Oops. Oh, I took out the pictures. Anyway, there's some very interesting pictures by artists documenting the little ice age at the time, and it shows frozen lands. The Thames was frozen for months in Britain, ice skating on the canal in Rotterdam, just frozen wastelands that was noted for crop failures, famines, and starvation. This was just a little tiny blip off this baseline. Well, now we've gone up about 1 degree. We're trying to keep the planet below 2 or 2 degrees, and that might not seem like much, but if you go back to the timeline to 2 degrees, this is a temperature in the Paleozoic and Cenozoic era that we've never seen. This is long before humanity, but you had palm trees in the Antarctic, and the planet was very, very hot. And crops need to grow at a certain temperature in order to thrive. So if the planet becomes too hot, then the crops are going to fail, and everything then crumbles down from there. So this is an existential threat to civilization that we absolutely must address. So now, in my analysis of antimicrobial resistance in Europe, I looked at many organisms, but only one in particular drove policy, and that was Enterococcus faecium. So I'm going to be focusing most of my discussion on this organism. The Europeans divided up bacteria into zoonotic and indicator. The zoonotic will cause illness in both people and livestock, and that includes the salmonellas and the campylobacters. And the indicator is part of the normal intestinal microbiome. That includes E. coli and Enterococcus. And again, I'm going to be talking solely on Enterococcus faecium and not Enterococcus faecalis. So there's a relationship between vancomycin and avoparcin. Avoparcin was a growth-promoting antibiotic used in Europe since the early 1970s, chemically related to vancomycin, which is one of the big gun antibiotics used in human medicine, and they were both glycopeptide antibiotics. The rise of Enterococcus vancomycin-resistant Enterococcus faecium caused great alarm, not only in Europe but around the world. In Denmark, the Danish scientists were concerned about the emergence of VRE in their livestock. They relied heavily on this drug, avoparcin, and in 1995, they identified VRE in some fecal samples from healthy chickens and pigs. And as a result of that, they concluded that they had to change their practices and stop using growth-promoting antibiotics. So they voluntarily stopped using it in 1995. In 1997, the European Union banned the drug, and then in 1998, Denmark went ahead and banned these other drugs, virginiamycin, which is a growth-promoting antibiotic chemically related to quinupristin, dalfopristin. And then in 1999, they stopped using all growth-promoting agents in response to consumer concerns. So this is Danish DanMap data, and you can see that the use of the growth-promoting antibiotics went down to 0 in 1999. And the blue bars are therapeutic antibiotic use, and unfortunately, when that ended with the growth-promoting, the therapeutic use then increased by about 120%. The Danish authorities were concerned by this rise, so they implemented a punishment system here, dropped it down by about 10%, but then it starts creeping back up. This is pork production. And by the way, in Europe, the vast majority of the antibiotic use is in the pork production. They use about 80%, poultry use about 20%, and cattle use just minimal. This is the human use here, and that's also been slowly creeping up. Now, this slide I plotted out using the Danish data, and what was so striking was after the avoparcin ban in Denmark, there was a nice 90% decrease of VRE on the farms in the years after the ban, and it's very striking. And I want you to remember what this looked like, this nice 90% drop. Unfortunately, paradoxically, in the hospitals, VRE kept going up. So there seemed to be a disconnect between what was going on in the farm and what was going on in the hospital. Excuse me. Now in Europe, they banned all growth-promoting antibiotics in January 2006. Fortunately, they established a number of surveillance systems to assess antibiotic use and resistance. Using a One Health approach, by the way, they included both humans and animals, not the environment, though. Unfortunately, reporting was voluntary for Enterococcus in livestock, so there just wasn't enough data to do any analysis on that, on the VRE rates before or after the EU ban. But what was interesting was that antibiotic sales for food animals mostly corresponded with the size of the livestock industry, but not exactly. And you can see it's kind of all over the place here. You have very minimal use here in Sweden, as well as Denmark. They were very judicious in their use. And then you've got France, Italy, I'm trying to remember which, I think that might be Germany, no, it can't be. I don't remember which country that is. Oh, it's Spain. I'm sorry, it's Spain. Yeah, that's Spain. And this is the percentage of the pig and poultry production as a percent of the country contribution. And again, Denmark has a very large pork-producing industry, but they managed to cut down their antibiotic use quite a bit. And then, of course, there's the big countries, and they correspond with high antibiotic use. Similarly, you see similar findings in human use. This is ECDC data. This is cephalosporins, and you see a wide variation between the Scandinavian countries, again, versus the Mediterranean countries. The Scandinavian countries use very little antibiotics, and the Mediterranean countries use a lot, which suggests that the use of antibiotics is very much cultural rather than based purely on medicine. We actually were talking a little bit about this over breakfast this morning. This is vancomycin use. Now, vancomycin use, interestingly enough, is not publicly available data. And the only way I was able to show this data to you was to not include the name of the country to which it corresponds. Now, why they treated this data like a state secret, I have no idea. But I had to sign a whole bunch of forms promising to adhere to their requirements. But nevertheless, the take-home message here is that there's a variation of antibiotic use by country, just as there is in the agricultural sector. Now, this is VRE rates of patients with VRE bacteremia in hospitals across the European Union. And what's so striking here about this graph is that it's quite frankly a mess. It is, you've got lines going up, you've got lines going down, and of course here's the Scandinavian countries who are very judicious in their antibiotic use, and they've got very low resistance rates. The avoparcin ban was back here. And remember the graph of VRE on the farm in Denmark where you saw that nice 90% drop? Well, that's not what you see here. Now, if avoparcin had been the cause of VRE in humans, one would expect to see a nice 90% drop across the board. But that's, in fact, not what we see. And you've got Ireland that's skyrocketing, and other countries where it's declining, and again, the Scandinavian countries. Now, what was also interesting, I looked at meat production in the years before and after the bans. The avoparcin ban was here, and the total low-dose growth-promoting ban is in 2006, which is here. And what's so interesting is, well, the EU was had a higher yield compared to the U.S. In the years before the avoparcin ban, you see a flip here. Whether that or not that's due to the ban, I can't tell you, but the timing is very interesting. And here's the low-dose growth-promoting ban, and you see kind of a widening between the EU and the U.S. The U.S. starts taking off, and the EU starts flattening out. Now, if that difference were due to the ban, you would see about a 3% relative drop between the EU and the US, and that's about a relative yield, and that would have cost the pork producers approximately $1.1 billion per year in 2012 dollars of lost revenue to the pork producers. The cost to the consumers is not known. However, according to the International Labor Organization, the retail price of pork in some countries is generally higher than the retail price in the U.S. But again, remember, the U.S. spends less on food than any other country on the planet. Now, interestingly, the ban did not affect chicken production. This is European Union here, and there's really no obvious effect. They've been in the middle, and they remained in the middle. And the U.S. is the purple line here, and just at the very end, we've been taken over by largely Brazil. Oh, but it's important to note that no EU ban included coccidiostats. That's an important point. Neither Sweden, Denmark, or the European Union included coccidiostats in their ban. Now, what happened in the United States was very interesting because the U.S. never approved avoparcin. We dodged a bullet, but for the wrong reasons. We didn't approve it because of concerns about its potential carcinogenicity rather than the epidemiology of, or the rise of VRE. So as a result, the epidemiology of VRE in this country is quite different from what you see in Europe. And I plowed through years of congressional hearings and testimonies. Congress has spent decades debating the risks of this growth-promoting antibiotics, and for years they've consistently concluded that more data is needed, but they never got around to appropriating funds to collect more data. And so that required bureaucratic leaders at the CDC, FDA, and USDA scrounge together funds to put together NARMS and NAHMS. So VRE emerged in this country in the 1990s in the hospitals, and in fact, even there's data suggesting that it preceded spread in European hospitals by maybe even a decade before it was actually recognized first in Europe. VRE is an enormous problem in this country. About 77% of healthcare-associated infections are due to resistant Enterococcus faecium that are resistant to vancomycin. There's about 10,000 VRE infections and 650 deaths per year. And antibiotic resistance is a huge problem in this country. No surprise that India, China, and the U.S. are the top 3 countries, the world's largest consumers of antibiotics, but not necessarily per capita. Per capita, Australia and New Zealand, for some inexplicable reason, prescribed more antibiotics to its people than any other country. That was quite a surprise. In this country, the food-producing animals receive primarily tetracyclines and ionophores, although it's not divided out by animal. So I can only assume that that might be similar to the situation in Europe in which you saw most of the antibiotics going to porks and chickens, but I can't be sure. When you look at the National Antibiotic Resistance Monitoring System data, you have data in chickens, chicken meat, and pork chops, and Enterococcus faecium that are vancomycin resistant was 0 in all the years tested. Unfortunately, NARMS did not collect this data on humans, so I can't make any comment on that. In the NAHMS, they collected data on resistant pigs, and again, 0 in the years tested. So there's absolutely no evidence that VRE came from the food-producing animals in this country, and yet we have a huge VRE problem in the hospitals. So what's going on? So let's quickly compare then the experience in the EU and the US. Europe approved avoparcin in the early 70s. The US never approved avoparcin. They had to ban avoparcin after the rise of VRE in the food animals. Vancomycin use is very high in US hospitals. They banned all growth-promoting agents after the problem with VRE. VRE appeared in hospitalized patients about a decade before it became widespread in Europe, appeared here in the US. There's absolutely no evidence that VRE came from US livestock. There's no evidence that avoparcin ban decreased VRE in hospitalized humans in Europe. We implemented voluntary measures here in the US in January of this year to stop all growth-promoting use of antibiotics. So you have this conundrum. You had VRE on the farms in Europe, no VRE on the farms in the US, big problem of VRE in Europe in hospitals, huge problem of VRE in hospitalized patients here in the US. But something just doesn't seem quite right, and advances in science and technology might have provided an answer to that. What we've been doing up until recently is when we track all of these resistance genes, we've been just looking at little snippets of the organism's DNA. And it's akin to putting a whole bunch of people in a room together who have red hair and trying to figure out how they're all related to each other based on their hair color. You simply cannot do it. You can't just look at somebody's hair color and figure out if they're related to each other. What you have to do is you have to look at the entire genome of the organism. So whole genome sequencing back in the early 2000s was $100 million per genome. And as time has gone on, advances in technology have allowed the cost to plummet. And fortunately, scientists have been able to actually do whole genome sequencing of VRE. And when they did that, some very interesting and unexpected findings appeared. It looks like 1 or 2 clones caused the initial outbreaks in people. And it became into multiple clones, but they all became endemic, and that clone is called VRE CC17. This hospital VRE strain appears to be genetically different from the VRE that was isolated in livestock in Europe and from healthy people in Europe. And this genetic analysis then suggests that the VRE precursor came from an animal, just not the farm animal that everybody had assumed, but instead it appears that it might have come from dogs. Now, when you think about it, now dogs don't get vancomycin, but they do get ampicillin. And the genetic precursor appears to be ampicillin-resistant Enterococcus faecium CC17 is genetically related to the VRE CC17 that you've been seeing all over in hospitals. And when you think about it, they share our food, they share our beds, they lick us. There's certainly plenty of opportunity for exchange of microbes in people's homes, but yet these animals have been completely invisible when it comes to the whole discussion of antimicrobial resistance, and not a single surveillance system includes them. So in conclusion then, there's no evidence that the EU ban decreased VRE in the hospitals. Antibiotic use varies tremendously between states in the US and countries, showing large variations in how medicine is practiced. Antimicrobial resistance surveillance absolutely must include whole genome sequencing, or we're going to make a lot of assumptions that might simply not be true. Antibiotic resistance in pets is an importantly huge reservoir that's been completely ignored and might be a hidden source of resistance and antimicrobial resistance in humans. So the question then is, where do we go from here? Can we have our pork chops and antibiotics too? Well, for the sake of time, how am I doing in time anyway? I'm going to stop right here, and hopefully we can talk about this. I have my ideas and suggestions in subsequent slides, but I want to turn it over to the next speaker to be able to talk with you on her perspective. So thank you very much for your time and attention.